This presentation is on the very early warning signs of heart disease and was brought to you by the Heart Innovation Research Program team. Heart disease is the #1 killer of women and men, so knowing these warning signs and the risk factors can help you catch heart disease early. This presentation will guide you through the symptoms, including what they are, what you need to know, and what to do next. Of course, we think of heart disease as being very important, and one of our research participants, who was 64 years old, agreed with us. Her statement was, it really is a hidden killer, is what it is. So I think the more we talk about it, the more we get it out there, the better it is. We hope that this video will allow you to begin the discussion of heart disease with your family, friends, and most importantly, your healthcare provider. The early warning signs are also known as prodromal symptoms. They are symptoms that can occur 3 to 24 months before adverse cardiac events occur, such as a heart attack. They can occur on and off, and the pain can be more or less intense at times. They can also occur either at exercise or at rest. How we know what we know. Dr. O'Keefe McCarthy studies these early warning signs of heart disease and that are not commonly talked about in the research and medical field. Early recognition of these warning signs can be life-saving, as it will allow people to get early treatment from their healthcare providers. This is a visual representation of these early warning signs that have been found in the research to be common among women and men. Some of the symptoms are well known, such as chest discomfort, but there are others that are often overlooked as they can be symptoms of other things. Often, people experience 2 to 3 symptoms at a time. These symptoms come and go, increase in frequency, and the intensity is different for each person, which makes it hard for them to describe them clearly to their healthcare provider. Therefore, we don't often recognize them as being related to our hearts. A common finding in the literature is the symptom of unusual fatigue. This means that the common activities of daily living are insurmountable, and people have described this as needing to take a break while making the bed. The next is shortness of breath. This can occur at rest or activity, and it is beyond what you would usually expect. It can impact normal activities, such as walking up 1 flight of stairs. Most people are aware of the cardinal warning sign of chest pain. However, over half of the time, women and men don't experience this. Prodromal aches and pains have been described as pains that occur in unusual places, which is why we don't relate them to heart disease, such as your elbow, the top of your hand, or your foot. The next is anxiety, and this is unusual or new anxiety, unrelated to a cause or event that increases in frequency. It has been described as a feeling of impending doom. A few of the other prodromal symptoms include insomnia, stomach complaints, pins and needles. These are all reported with different levels of intensity and frequency, and this makes it hard to understand the possible severity of the symptom, and that's why they're not recognized as a warning sign of heart disease. Here I will present a case study. A 65-year-old woman who had a history of high blood pressure and diabetes was experiencing unusual bouts of unrelated anxiety, increased nausea and vomiting, not related to the flu, intermittent periods of chest pain, and insomnia. Her family physician and internal medicine physician thought that these were related to her diabetes. Because she had a strong family history of heart disease, her internist thought it would be best to also test her for heart disease. It was found that she had 2 blocked arteries and needed to have a procedure to keep the blocked arteries open. Therefore, she had heart disease and experienced 4 different prodromal symptoms 3 weeks prior to her cardiac procedure. Cardiac-related fatigue is often hard to categorize, as it is not thought of as relating to heart disease until after the heart attack. People rationalize it away as relating to other things or other conditions they are dealing with, and don't recognize it as relating to poor heart health. A sample quote from a male participant age 74 is, "It's not fatigue from exertion, it's fatigue from total relaxation. You know, because that's significantly different than what I ever expected." Shortness of breath was described by one of our participants as, "I couldn't even vacuum the house. By the time I would get up the top of the stairs, I had to stop so that I could catch my breath, and I'd have to wait it out a little bit." Stomach complaints such as nausea, heartburn, and indigestion is also common. One woman described it as, "I had a little bit of heartburn or something. I popped a few Tums, it went away." Dr. O'Keefe McCarthy did a summary of 7 different research studies looking at these early warning signs of heart disease and found that before people experienced the heart attack, they reported these warning signs. 100% of the studies reported increased anxiety and unusual fatigue. 87% reported arm pain and shortness of breath. 71% reported stomach complaints. 57% reported chest discomfort. 43% reported dizziness, back pain, and jaw pain, and 29% reported headaches and sleep disturbances. Some risk factors include, but are not limited to, family history of heart disease, diabetes while pregnant, high blood pressure, smoking, and others. Visit Cardiac Health for a risk meter that they have on their site that will help you assess if you might be at risk for heart disease. Soon, you will be able to visit catchheartdiseaseearly.ca to complete an online questionnaire that will ask about your experience with these prodromal symptoms. It also asks about your personal risk factors. It then provides you a score and a printable report that you can use to begin this discussion with your family doctor and healthcare providers about heart disease. You can visit the Heart Health Education site at sokeefemccarthy.ca for Videos of Women, which presents the lived experiences of women with heart disease and the background into the research study on it. There's also further information on this page, such as videos as how to use the online screening tool, plain language summaries of some of Dr. O'Keefe McCarthy's pivotal research, educational tools, and more. Here's a sample of the resource site. So, in the words of one of our female participants who was age 64, "Until I had my heart attack, I never talked about heart disease. And when you look at the stats, and you look at the numbers, and you look at the amount that have it, that just don't know about it." We hope that this information and the further information on our website will help you talk to your family, friends, and healthcare providers about heart disease. As I said earlier, please visit sokeefemccarthy.ca, or you can email the address on the screen for further information. Thank you.